Hatvet PHARMA welcomes you to the ocean of practical knowledge about small animal practice. That is Hatvet's YouTube channel.
Dr. Chandrashekhar sir is a renowned clinician having a clinical experience of more than 20 years in small animal practice. He has pursued a postgraduate degree and a doctorate in veterinary clinical medicine. Currently serving as a professor in the Department of Veterinary Clinical Medicine at MVC Chennai, he specializes in veterinary medical oncology and small animal internal medicine. Hatvet family extends a heartfelt gratitude to Dr. Chandrashekhar sir for sharing insightful content with our fellow veterinarians. Thank you, sir.
Dear participants, today I would like to tell you about the importance of bleeding emergency in small animal practice. So, what are the points you need to remember while addressing the bleeding emergency? We all know that bleeding emergency due to multivarious factors, and we'll address one by one. So I'm Dr. Chandrasekhar, Professor of Clinical Medicine, working at Madras Veterinary College, in charge of the Emergency Critical Care Unit. And these are the gmail.com is my mail ID. My WhatsApp number is available in the first image. So some of the points you must understand about the blood transfusion in small animal practice. So why there is a bleeding emergency? Why there is a bleeding? There are several reasons that causes the bleeding. One is the external parasite that caused by the tick infestation, internal parasite that caused by the worm infestation, trauma, coagulopathy disorders, thrombocytopenia, and some of the factors deficiency that causes bleeding disorder in dogs. And similarly in cat also, the bleeding disorder caused by various reasons: external parasite, internal parasite, trauma, clotting factor defect, thrombocytopenia, and so on. So once you get these problems, it is an emergency. If enough amount of blood available in the circulation, animal may not be able to carry on the normal activities. Some of the common reason in case of dog, the most important reason in our country, it's mainly due to hemoprotozoal disease. One of the hemoprotozoal is Ehrlichia canis. This Ehrlichia canis caused by the Rhipicephalus sanguinis ticks. Once it bites, it transmits the monocyte organism into the monocyte. Then it will spread to all other WBCs. There are reported, they are also recorded in the neutrophil, eosinophil, and the basophils. And so far we know that it is getting transmitted through the ticks. There are occasions it will also getting transmitted by the mosquitoes. So any biting vector, it can transmit the problems. So what are the points you need to remember? The Ehrlichia canis, already I told you, multi-system affecting rectal disease, and it will affect all other organs. And it also causes reduction of WBCs, reduction of RBC, reduction of platelet count. So the Ehrlichia canis organism that will also result in vasculitis. So imagine there are blood vessels in the nasal cavity. It ruptures the blood vessel in the nasal cavity. There will be a bleeding. It will causes bleeding through the nostril. It can be unilateral. It can be bilateral. And another thing is, sir, there are occasions there are rupture of the blood vessel in the eye. That retinal blood vessel that causes a collection of blood in the anterior chamber of the eye. That they call it as hypema. And then there are occasions they become blind. This is another important sign. So I told you it will cause a reduction of platelet. Reduction of platelet, it causes pinpoint hemorrhages. The pinpoint hemorrhages, they call it as ecchymosis, or if the hemorrhages are wide, they call it as purpura. So when you see ecchymotic patches on the ventral aspect, abdomen, or any other part of the body, So you must understand that there is a thrombocytopenic condition. Carry on the blood parasitic test, carry on the serological test, and then identify the cause for the problem, and then do a PCR test, identify the cause for the problem, and then treat accordingly. These are all the message about the early checking. And also other thing I told it is a multi-system affecting blood parasite. Once it affects the internal organs, and most important thing is it causes enlargement of spleen. The spleen, it will consume all the platelet available in the animal body, so it causes enlargement. And another important thing is it will also causes renal failure. All the E. canis organism, it causes glomerulonephritis, and then result in renal failure, elevated blood nitrogen and creatinine. Another important observation, it causes hepatic failure. You will have elevation of ALT, AST, GGT, total bilirubin, and conjugated bilirubin. These are all the biomarker for the hepatic. Biomarker for renal is you have a blood urine nitrogen and creatinine. There are occasions cerebral involvement of early choices. The animal also develop convulsions, and the animal which are having lung involvement, they have a pneumonic sign. Animal which are having gastrointestinal form, when they are involving gastrointestinal system, there will be a vomiting and diarrhea. And animal which are affected with gastrointestinal ulceration and erosion, they will also have a melena. And already I told you the E. canis organism, it causes reduction of platelet, reduction of WBC, reduction of RBC. So when there is a reduction of platelet, you will have a melena, and there are occasions you will have a hematemesis, there are occasions you will have a hematochezia. And there are reports in early sources you will have an enlargement of hind leg edema will be there. And these are the some of the prominent signs in case of animal affected with the early choices. So the blindness, if you identify the problem well in advance, you can correct the problem of blindness. If you treat the case with the doxycycline 10 mg per kg body weight, and apart from that, you also combine prednisolone. The doxycycline, it eradicates the morula-shaped organism that are present in the WBCs. Prednisolone, the steroid, whatever you are giving, imagine there is a blood vessel. The leaking of the blood vessel can be prevented. It will also repair the vascular endothelium basement membrane of the blood vessels. So these are all the advantages. So animal affected with thrombocytopenia due to early choices, and giving a doxycycline. Apart from that, you will also give a prednisolone. It will repair the vascular endothelial basement membrane repair. These are all the advantages. So if we can give periodically, 10 mg per kg body weight once a day for 28 days, you can prevent the problem of early choices, and you can avoid the multi-system affecting involvement can be prevented. So blindness can be reversed, bleeding can be controlled by proper treatment with the early choices, and the ecchymatic patches can be controlled or come to reverse to normal, and all the multi-organ involvement can be prevented by effective method of controlling the E. canis organism. Another important observations, especially in case of early choices, you see, you take a drop of blood from blood smear, from tip of the ear you take. From the tip of the ear, sometimes you may miss the morula-shaped organism. And then what you have to do is, you also do a serological test. Serological test, the problem is even treated animal also become positive. So the best method for treating early choices, better you go for PCR technique. PCR technique, the presence of organism can be identified very easily, and then you can give the proper treatment to the animal. Another important observations, there are several snap test kits that are available commercially. They give a conjugate. You have to add the conjugate on the well. Then you have to add the few, maybe 4 drops of conjugate, 3 drops of blood. And if you add, if the organism present, the particular area, you will get color coding, the presence of organism can be identified. There are commercially available kits marketed by various companies. You can detect early chosis, you can detect Anaplasma platis, you can also detect Diarrhea emetis. So several parasites you can locate with the snap test. But sometimes there are controversy in the serological diagnosis of the result interpretation. So if we can go for PCR, the presence of organism can be identified very effectively. Even the small amount of the organism present, it can trace, very easily by polymerase chain reactions. So subjecting the cases when you suspected for early chosis, subject them for PCR technique, the presence of organism identified very easily. This is an important technique. And day-to-day practice, you can do this test very easily. There are multinational company, they have got the kit to diagnose the problems very easily. But sometime when you miss, that time only we insist, better go for PCR technique, and the presence of organism can be identified very easily. Another important thing is the EKNS itself, multi-system affecting that parasite. The most important clinical sign of early chosis, you will have a diaphasic fever, increased temperature will be there, then decreased temperature will be there, and then vomiting, and then you will have epistaxis, you will have melena, you will have hematogasia, there are hematemesis, then pinpoint hemorrhages on the body surface. There are occasions animal develop get convulsions. There are occasions if it is a male dog, they have a scrotal edema, and then pneumonic changes, the breathing distress, all those things encountered in case of animal affected with the animal affected with the EKNS. This multi-system affecting involvement will be there. These are all some of the information concerned with the early sources. Similarly, all these things I told you, it is getting transmitted by the Rhephicephalus sanguinus ticks. The Rhephicephalus sanguinus tick, not only Rhephicephalus sanguinus, any biting vector can transmit. We have a commercially available product, starting with the topical application, oral applications, collars, powders, and so many preparations that are available. But they want the recommendations with the the research carry on with the various companies that are commercially available. What they suggested, you can go for external applications, tying the collars, then internal applications, controlling the environment. So all this method only you can completely eradicate the various stage of the ticks. You can control the problem in the dogs. So you can avoid multi-system affecting episode can be avoided if we can adopt all these methodology. That's what the recent recommendations. Multi-level approach needed, and you need not to stick on to only one product one time. If you are using one product, the ticks that are prevented the particular they develop resistance, you need to switch over to some other product next time. So these are all some of the message concerned with the early choices. There are consensus statement on early choices. Previously, they start the treatment with oxytetracycline. Nowadays, the recommendation is doxycycline 10 mg per kg body weight you need to give for 28 days. Apart from that, and coming to your breeding emergency, why is this an emergency? Country like India, we get 1 in 4 dogs prone to develop hemoprodrome. This is a very common problem. Academicians, students, and researchers, and we need to have a solid data all over the country. And each and every state, they must have a strict policy, tick control measures. And then all the animal husbandry department, they should coordinate with the institute. So institute is in turn, they send the researcher to the field level, coordinating with the field vets, and then collect the samples, all the vectors they have to collect, all the affected animal samples they need to collect. And you can have the collective data in particular state. For example, I am speaking from Tamil Nadu. Tamil Nadu, we need to have the data our own state. If a dog they are going from Tamil Nadu to Karnataka or Andhra Pradesh, we must have a strict quarantine control measures. Or I must do a snap test, I must do a PCR test. PCR test, if the dog is negative only, I have to move the dog from Tamil Nadu to Andhra Pradesh or Tamil Nadu to Karnataka, I can transfer. So like that of policy control we must have. Once you don't have the policy, definitely the ticks will be there, tick related problem will be there, and it is very difficult to eradicate, and the lot of expenses, a lot of mental agony among the family. Pet become the family member in the house. The pet parents emotionally disturbed when they get this problem. And apart from that, the bleeding from any parts of the body, it is an emergency. You cannot, the dog is limping, you can attend next day. The dog is not eating, you can attend the next day. But the bleeding is an emergency, you cannot delay. This has to be addressed immediately. Why there is a bleeding? So I told you one etiology, is related problem. There are clotting vector defects, there are fibrinogen defects, there are prothrombin defects, partial thromboplastin defects. All these factors, there are the 1 millibrand factor deficiency. There are hemophilia A, hemophilia B. So these are all the some of the defect which also causes bleeding in the case of small animal. Apart from that, some animal consumed any chemical. Like example, you think of rodenticide chemical injection. Rodenticide chemical injection destroyed all the clotting factor in the animal body, and there will be a bleeding sign. There will be a hematomesia, and the suddenly animal become hypotensive because of loss of blood. So we need to address the case. What type of chemical that are present in the rodenticide chemical, and then you need to give the antidote immediately. Then only especially warfarin poison, we give an antidote called vitamin K, and with timely administration of vitamin K, you can reverse the problem. Animal which are anemic due to rodenticide poisoning, animal which are anemic due to ehrlichiosis, animal which are anemic due to babesia.
Hatvet Pharma presents Turbiraj, Terbinafine tablets, a trusted choice for stubborn fungal infection in pets. Turbiraj is available in the following formats: Terbinafine 250 mg tablets, Turbiraj 250, Terbinafine 500 mg tablets, Turbiraj 500. For placing order, contact our sales team or WhatsApp 98372 53817 or visit www.hatvet.com.
Animal which are anemic due to babesia zipzoni, so animal which are anemic due to ankylostomach caninum, all these problems, giving a blood is a life-saving procedure. Another important thing is, though the procedure is life-saving, but it is not a permanent solution. You have to identify the cause for the anemia and then address the problem accordingly. If you don't identify the cause for anemia, if you are symptomatically treating, then again and again the dog will become anemic. You will not be able to address the problem, and you will not be able to save the animal from critically ill conditions. So these are all some of the message and concerned with the Ehrlichia canis. And then coming to babesia canis, is also getting transmitted by the ticks, but these parasites affect the red blood cells, and the red blood cells, once it destroy red blood cells, hemoglobin getting liberated, and that causes anemia, that causes jaundice, in the end up with renal failure and multi-organ failure. So this also, once the renal profile, hepatic profile markers are getting elevated, abnormally elevated, it is very difficult to bring back to normal level. If it is the early stage, suppose the creatinine value 2.8 or 1.8, suppose ALT, AST and all minimum level elevations. If you identify the cause for this problem is a babesia canis, then you can treat the case with the diamidazole acetate at the dose of 3.5 mg per kg body weight. You can eradicate the problem. You can save the life of the animal. This is another. Then babesia zipzoni, this also result in hepatic failure, renal failure, multi-organ failure, sepsis and death of the patients. And this all these babesia zipzoni, we can control with the triple therapy called doxycycline 10 mg per kg body weight, clindamycin 15 mg per kg body weight twice a day, metronidazole 10 mg per kg body weight twice a day. We give them for 28 days. Depends upon the tolerance of the animal. We keep checking all the profile. Depends upon the response to the animals, and then we assess the clinical improvement. We treat them accordingly. There are 10-15 protocol given for treating the Babesia zygoni. Out of all the recommendations, we found a better response by giving this therapy. There are occasions they also use buprenorphine, but using buprenorphine is quite expensive. But triple therapy we found a lot of success rate in controlling the problem of Babesia zygoni. This is another important information about the Babesia zygoni. Another important information I want to tell you about Anaplasma platis. Anaplasma platis, it is present in the platelet. It will also result in thrombocytopenia, and there will be a bleeding disorders. As I mentioned, it will cause epistaxis, and it will cause bleeding any part of the body. Epistaxis, what we are seeing outside, and the EKN is Anaplasma platis. They call it silent and deadly killer disease. Suddenly, the abdominal vessel rupture means there will be a hemoabdomen, hypotension, the animal will collapse. So the message is you need to identify the primary cause and address the problem accordingly. Anaplasma platis, there are snap tests available, there are molecular tests that are available. The presence of organism you can identify with this test, and then you can treat them with the doxycycline 10 mg per kg body weight for 28 days. You can eradicate these problems. In our country, I found a lot of Ehrlichia canis, lot of Babesia zygoni, lot of Babesia canis, lot of Anaplasma platis, then worm infestation. These are all the major reasons that causes anemia, bleeding disorder, multi-organ failure, death of the animal. Since I am in the emergency critical care unit, there are several students, some they are working on the thrombocytopenia, some they are working on renal failure, some working on hepatic failure, some working on the systemic inflammatory responsive syndrome, and some is working on multi-organ dysfunction syndrome. But all these parameters, if you look into what is the causative factor, is majority of them is due to hemoprotozoal disease. Then imagine that when we do PCR, we will come to know that, and that will end up with the multi-organ failures. So, dear friends and professional colleagues, so a country like India, we need to address the hemoprotozoal disease. And even recently, I sent a proposal to Department of Biotechnology to screen the hemoprotozoal disease. Another important message I am telling you, whether you are a Ehrlichia canis and even TRIPS, the majority of the blood parasites, recently they identified they are all zoonotics. So it's better to control the problem at the as early as possible. Then only you can control the problem to human being side and also control the problem to animal side. So we want to work. And recently we gone through some of the literatures. There is a Korean article stating that there is a virus behind it. Apart from transmitting this blood parasite through pigs, there is a virus also responsible for the mass transmission of these problems. And recently we got a report from all police dogs, we missed healthy dogs, periodically given vaccination, periodically deworming dogs, we missed. Then when we carefully screen the molecular testing, we identify the reason for the mortality. We identified majority of them they carried Ehrlichiosis, Babesia canis, and Babesia zygoni. These are all the reasons. With the controlled populations, we carried out the research, and these are all the information we carried out. Other healthy animal, we put them on with the doxycycline. Then we also give imidacloprid dipropionate 6.6 mg per kg body weight subcutaneously. Then after 15 days later, we repeated the imidacloprid dipropionate. This is the way we manage the hemoprotozoal disease induced by various organisms. Like Ehrlichiosis can be tackled with your doxycycline, and similarly, Babesia zygoni and canis can be handled with this imidacloprid. And then Clenda and metronidazole we gave them for a couple of days. So thereby we controlled them. After that, we did the PCR. PCR we found the negative of all these organisms. And then coming to the role of bleeding emergency, what is the blood bank role? The role of blood bank, if anyone start a blood bank in a private practice in India, you must have a blood license from the blood controller of India. So if you cannot start the blood bank without getting the permission from the blood controller of India. So you need to write it to the Animal Husbandry Secretary. The Animal Husbandry Secretary in turn talk to the government. then through them only you need to get the permission to carry on the blood transfusion activity. Because as per the World Health Organizations, keeping the blood bag in your premises is an offense. So better you get the permission from the blood controller of India, then you can save the critically ill animals when they need blood. So apart from this, what are the other problem what they encountered? Majority of the places, they don't keep dog in the premises. You must keep a dog. If you are running the hospital, veterinarians and vet students and the technician, attendant, they must keep a couple of dogs. Maybe they must keep a dog, they must keep a cat, and they must keep a small amount of birds and other things. Coming to dogs and cats, these practices are predominantly present in India. So what you need to do is, if you have a dog, you can periodically deworm them. You can periodically give all the vaccine. Periodically check the hematology, biochemical profile, including platelet, and give essential shots like rabies, distemper, parvo, or leptospirosis. If you give that, the animal develop adequate immunity against various commonly available diseases, so that you can bring the dog for donating the blood. Normally, the criteria for donating the blood, the dog should be more than 25 kg body weight. Preferably male dog or neutered dog would be ideal. Even nowadays, what they're doing, even the pregnant dog is the ideal dog to donate the blood. So that's what the recommendations. So you can collect the blood, and once you collection of the blood, normally you have to do it with the jugular vein. You collect the blood from the jugular vein, and then there is a blood bag called citrate phosphate dextrose adenine solution containing blood bag. From the CPDA solution, you can collect the blood. Actually, if the blood base 350 ml blood bag, 350 ml blood bag, 39 ml of anticoagulant will be there. So remaining portions are blood. So you need to, they have tried with apparent, they tried with the sodium citrate. Among all the available anticoagulants, they found the better response with the CPDA solutions. And then what you have to keep the animal on the lateral extremity, save the fur on the jugular vein, then collect the blood, and you must have a trained team, trained doctor, trained nurses, technicians should be available, and the animals also should be docile. And keeping the dog as a pet, in my opinion, better keep a bigger dog. And if you keep a bigger dog, the collection of quantity of the blood also will be more, so that we can save more number of animals. It's like how the blood being donated in the human side. Similarly, if you have a couple of dogs in the hospital or individual, they are having one or two dogs, definitely we need not to depend on the owner. And many owners, they won't be willing to come and donate their blood. They think that they are doing harm to the dog. And nowadays is better. You think about 10-15 years more before, requesting the owner to bring the dog for blood donation, no one will come forward. With all the difficulties, we used to manage the blood administrations. And so in my hospital, I have 4 or 5 dogs in my shelter. What we do, we periodically give them vaccination, periodically give all the vaccines, and we know our and also we type the blood groups. I have a CP-PHARMA in my shelter, that is a dog erythrocyte 1.1 negative. I have a brownie ordinary country dog in my house, that is also 1.1 negative. Actually, the aged dog now, brownie is a 14-year-old, it's able to save 10 dogs in the lifestyle. So another CP-PHARMA, quite interesting find in CP-PHARMA, the majority of them are there now 1.1 negative. So as per the available literature, there are several blood groups in dogs. Starting with 1.1, 1.2, 3, 4, 5, 6, 7, 8, 9, they have gone up to the 13 and the 14. So the dog erythrocyte 1.1 positive blood group, it will cause a serious transfusion reaction to the recipient. So always, the donated blood should be a dog erythrocyte 1.1 negative. You have to prefer. So that is the message. There are snap test kits that are available. Those kits are all, to detect 1.1 negative thing. They'll check. Or 1.1 positive or negative, we can identify. So collection of the blood we are doing with the CPDA solution. Before that, there are 2 tests they do. One is major matching, another one is minor matching. Major matching, they collect donor red blood cells and recipient serum, mix it together. If you see agglutination, you are not supposed to give donor blood to the recipient. Similarly, they do minor matching, vice versa of the above procedure. That's also to avoid the unwanted reaction among the donor and recipient, so that you can avoid complication to the recipient. So the message here, you can do a major matching. You also do a typing, and the most important thing is in your practice, get the consent from the owner. That is very important. If you don't get the consent from the owner, then carry on the blood revenue. Suppose the anemia animal, normally they will be with the multi-organ involvement. If you don't get the consent, if you are carrying out the transfusion, there are transmission reaction develop. Suppose the animal develop anaphylactic shock and collapsed means, you will be in trouble. If you get the consent, explain to the owner what are the problem the dog is having, what are the do's and don'ts in blood transfusion, explain to them. Then accordingly, you can plan for your procedure, and you will also have a mental peace of mind. You can carry on the procedure without any disturbances. That's all about the legal point of view. Then setting up a blood bank, you need a 20 lakhs rupees. You need to have a deep freezer, you need to have a platelet separator. One important component, the whole blood is having a red blood cells, WBCs, and then it is having a platelet, and it will have a plasma. There are clotting factor in that. So all these components that are available, if you collect assets and giving to the recipient, it's called whole blood component therapy. If you collect the blood and then dividing the various components of the blood, suppose the individual having a congestive heart failure or renal failure, and it needs only a platelet, and those patients, if you are giving whole blood, then it will become a volume overload to the patients. So what the message, what the article is quoting, patient affected with the congestive heart failure or renal failure, better you go for component therapy. Depends upon the need of the patients, you can give the blood component and save the patient. That is the message. And there are clotting factor defects, there are coagulopathy defects. And those cases, what you can do is you can do a buccal mucosa bleeding test. So what you need to do is the buccal mucosa bleeding, there is a separate BP blade available. Then you make a small nick on the buccal mucosa. Normally within few minutes it has to clot. If you keep on bleeding after 3 or 4 or 5 minutes, then you think about the animal may be having a clotting factor defect or platelet disorders and so many other bleeding disorder conditions. It is one of the easy and the simplest tests that can be performed in your day-to-day practice. That's all about the buccal mucosa bleeding time. And then identifying the snap test kit. The snap test kit, it is available readily. They give a conjugate. You have to add the blood there. Probably 4 drops of conjugate and 3 drops of blood you have to add. If the donated blood is having 1.1 positive, the control well will be red. Adjacent to that, you will get one more marking. One more marking. That is called that is indicating that this is positive. Let me see whether I can share. There is a option to share the board. Okay, in the subsequent slide, when I play, I will explain to you. And then other things, the snap test kit, when I go out with the subsequent slide, I will explain to you. There are the PowerPoint slides that are available. And then suppose the donated blood is, is having a 1.1 positive, and you can also identify the accumulation reaction in the collected blood itself. Otherwise, one of the simple donor red blood cell recipient serum, you separate and mix it on the slide. The slide itself, you can see accumulation. If you see the accumulation, that means you need to avoid, administering the donor blood to the recipient. These are all the trouble. Another important message, then how much you have to give, how much blood you can donate. Normally, You can donate. There are formula that are available. Before the formula, the importance to the practitioners. So you can collect, every kg body weight, the dog can donate 10 ml of blood. Similarly, the recipient, every kilo body weight, you can give 10 ml of blood. There are formulas that are available. The formula helpful for our academic purpose and practitioner point of view. This is very simplest and easiest. You can understand very well. Then there are what are the now administration. Administration where you will give collection from the jugular vein. Administration you can do with the cephalic vein. Save the cephalic vein and then fix the needle. Depends on the size of the animal. Then you administer. Suppose you remember a previous presentation I told.
Hatvet Pharma presents Azithrohat, azithromycin syrup and tablets, the cure that embraces with care. Azithrohat is available in the following formats: Azithrohat oral suspension, Azithrohat syrup, azithromycin tablets, Azithrohat 300 tablets. For placing order, contact our sales team or WhatsApp 98372 53817 or visit www.hatvet.com.
Suppose if you are not able to select the peripheral result, if you are not able to select the center line, one of the technique what you can do, you can also try a cut down technique. Just cut down and then fix the catheters. You can administer the blood. In spite of all these attempts, you are not able to raise the vein even with the cut down technique. Better you go for intraosseous technique. Even I told you about last presentations. Intraosseous technique you can try in several places. One of the places normally which I prefer is the femur head. Some of them they prefer the wing of the ilium. Some scientists they prefer the lateral cantle of the humerus, this particular part. So these are all the sites you have enough space wherein you save the area, infiltrate little. Then there are intraosseous needles that are available that you can introduce for day-to-day clinical practice. What I want to insist, you can use even the smaller dog. You can use 21 gauge needle. Smaller puppies or kitten, you can use 21 gauge needle. Bigger dog puppies like Rottweiler, Great Dane and all, you can use 16 gauge needles. I told my preference is the femur head, trochanteric fossa of the femur. What I do I save the area, I infiltrate lignocaine. Then suppose the smaller puppy, I take 21 gauge needle. Before introducing a 20 gauge needle, I will actually loaded the epernized saline into the syringe. Then I will fix the. Before that, I infiltrate lignocaine. Then the epernized needle, just I introduce. After introduction, then the loaded blood, I'll infuse. If it is in the medullary cavity of the femur bone, it will go very easily. If it is going subcutaneously, you can see a collection of blood subcutaneously. You can easily identify. That's the one message. Another message, suppose you want to check whether the needle is inside the medullary cavity of the femur bone or outside. You keep moving the femur bone. Parallel to the movement of the femur bone, the needle is also moving means. That means the needle inside the medullary cavity. If it doesn't move parallel to the movement of the femur bone, that means the needle away from the femur medullary cavity, you can identify. Another important, easiest technique, you can what you can do is you can take an X-ray. By taking an X-ray, the presence of the needle you can identify very easily. Then you can administer the blood very easily. And the bony area is having a lot of porosity. So a lot of blood vessels communicating spaces are available. So once you give the blood, it's getting absorbed into the circulation immediately. How you are giving intravenously. Similarly, any drug, any fluid, whatever you are giving, immediately it goes there. All the emergency critical care specialists, internists, emergency in intensive care specialists, their hands should be trained by doing this intraosseous technique, because everything has to be done within a minute or two. The more you delay, the more the mortality, the more the complications. So your hands should be trained with the intraosseous technique. We have the slide that I will also share it. Another important point which I want to share is that now we have given the blood. So what are the reaction? See, this is a foreign protein we are going to administer to the affected animal or the anemic patients. Anemic patients, how you check it, the most important thing is it will have a pale mucous membrane, pale buccal mucosa. If it's a female animal, pale vaginal mucous membrane. If it's a male, pale penile mucous membrane. You can see with your naked eye. If you have a powerful source of torchlight, you examine these parameters. And the anemic patient, they also, when you auscultate, they'll have a hemic murmur. That also you can auscultate. Anemic patient, they become dull, they won't walk properly. And these are some of the classical signs you can observe in case of any patient affected with anemia. So anemia patients, now we selected the donor dog. We want to administer the blood. Administration of blood, initially it has to be given very slowly. I told you already it is a foreign protein. When you administer, the recipient develop transmission reactions. To avoid the transmission reaction, what you are doing is you need to go for some anti-allergic injections. My preference, normally what I will do in my practice, before going for the transfusion, we select all the parameters. We collect the donor red blood cell, recipient serum. We do major matching. We also do a snap test, and if they are fit, then we'll go for transfusion. We'll also get the consent from the owner, and we'll also give a counseling to the families. Then we'll take it for blood transfusions. So the message here, before the transmission itself, I'll give 1 to 2 mg of prednisone to the dog. So thereby, if I go for a transmission after some time, I'll avoid the transmission reactions. That's the way I manage the problem of transmission reactions in my small animal practice. So there are occasions while collecting the blood, collection of the blood, I told the jugular vein is superficial, very easy. You can collect, but many times, the animal which are obese, majority of the Labrador, they are obese. And collecting the, blood from the jugular is quite challenging. Normally, what we do, we sedate the animal, donor dog, then we collect the blood. We use buterol and we use diazepam sometimes. And the animal which are not able to control in spite of buterol or diazepam, still the animal is awake. And we'll go for, xylazine 1 to 2 mg per kg body weight. Though xylazine causing hypotension, bradycardia, but after some time, if you go milder dose, see, instead of 1 mg or 3 mg, go for 0.25 mg per kg body weight. With the milder dose, animal ferociousness can be minimized. Then save the fur on the jugular area, raise the jugular vein, then introduce the needle, then collect the blood. Then while transmission, while collecting, if there is an infection around the catheters or while the collection, the infection get into the blood bag, and the pyrogen that are present in the blood, while giving to the recipient also develop pyrexia. To control pyrexia, better you give a broad spectrum bactericidal antibiotics. You can control the problem of pyrexia. There are places what they do, they also do a blood culture. They identify what type of organism causing the problem. They do a ABST, then accordingly they treat the problems. Another important thing is, you are not supposed to use the ordinary IV set for administering the blood. You have to use only the blood transfusion set, blood administration set that are commercially available, that can be used for administering the administration of the blood, because it will filter all other unwanted items, all other debris, all other unwanted items. It filters, and then the purified blood, it goes to the patients in a safe methods. That's all about the use of blood transfusion set comparing with the ordinary IV set. And then blood collection bag also, it should be gentle. If it's too much vigorous handling, there will be hemolysis of the collected blood, and you will have to handle very gently. This is about the whole blood. I told you the whole blood divided into various components. That is called component therapy, and that I will tell you in the subsequent slide. So this is all about the then transmission reaction, pyrexia. I told allergic reaction, how manage, I told you. There are dogs, they develop fits or convulsions. Convulsion or fits, immediately already you fix the catheter in the vein, stop the blood, give a diazepam 0.2 mg per kg body weight. You control the problem of epilepsy. You can we can save the animal from critically ill conditions. That's all about the using Dicynone. Another thing, animal which are having anaphylactic shock. Some animals they have anaphylactic shock. On those cases, what you have to do is you need to give adrenaline, so through IV, so that the shock can be prevented. And the adrenaline, it will improve the contraction of the heart, and it will supply the enough quantity of blood to the peripheral circulation. So all the vital organs get the blood. So hypotensive crisis and death can be prevented by doing these procedures. So these are all some of the reactions. Sometimes we are using a CPDA, citrate phosphate dextroadenine solution. Suppose the blood is low, CPDA solution high, the citrate that are present in the blood bag, it will combine with the calcium of the patient, it will cause citrate toxicity, and then it will take all the calcium. So in those cases, you have to supplement the calcium to the patients. There are occasions they also develop a convulsion because of the loss of calcium. You need to supplement the calcium to the animals. But normally, if you have enough quantity of anticoagulant, enough quantity of blood, means you will not have this problem. So allergic eruptions, anaphylactic reactions, pyrexia, epilepsy, citrate toxicity, these are all the methodology we have to manage like that. Another important thing is where to store the blood. The whole blood can be stored in under 5 degrees centigrade for a month. Platelet you can store for a week. So you have a red blood cell when you are keeping, or when you are centrifuging, red blood cells settle down. Then you have a WBC. Above that you will have a buffy coat. The buffy coat is contain a platelet. Above that you will have a plasma. The plasma is contain clotting factor. This can be, previously they used to store for 2 years. Now this can be stored for 3 to 4 years. If you are storing a plasma pressure, that is called fresh plasma, contain lot of clotting factors. All the coagulopathy conditions, this can be used. And patient with having a lot of burn problems, this plasma is a potential supplement. So you can reverse the problem of there are all the clotting factor deficiency. That's one thing. And another thing, the next is the platelet. Platelet can be used. A patient affected with immune-mediated thrombocytopenia or thrombocytopenia due to various reasons. When you want to control the bleeding, if you give the platelet, immediately the bleeding can be controlled. That's because the ready-made supply of platelet, it will prevent destruction of the ongoing platelet crisis. It will avoid bleeding condition. Temporarily, it controls the problem. But you need to separate the problem. If it is anaplasmaphyresis, you have to give doxycycline, so this problem can be prevented. If the problem epistaxis due to E. canis, you have to give doxycycline. If the problem due to Babesia canis, you have to give a diaminoxidil acetate dose of 3.5 mg per kg body weight. So if it is a Babesia zygoni, you have to use triple therapy, doxycycline, metronidazole. And with this, if hemoprodosone early shows or Babesia occurrences, we give doxycycline, and we also give imidacloprid dipyridate 6.6 mg per kg body weight. Once in 15 days interval, 2 shots we give. These are, apart from that, there are supplement people. They have a lot of products. The papaya leaves preparations having a lot of properties to boost the platelet level. Many companies they came forward with this product. They're starting with the thrombophyt, and so many available in the market. You need to supplement that, so thereby you can avoid the problem of thrombocytopenia. You can save the animal from critically ill conditions. So these are all about the storage and then transmission reactions. And what are the drug you need to administer, also I told you. And then snap test also I told you. Cross reaction I told you. Then puppies and the kittens, how do you do transmissions? Puppies and kittens, you must have a transmission. You must have a butterfly needle. Before that, you coat the 50 ml syringe with anticoagulant. Then you aspirate the blood from the healthy donor. I told you what are the criteria. Those criteria you have to keep it in your mind. Then collect the blood. Once you collect the blood, then you can transmit to the recipient slowly. So I told every kg body weight you can give 10 ml. Like that, you can transfuse the blood. And this will be our life-saving procedures, especially puppies or kitten with the anemic conditions you can give. But the problem with the cat or the kitten, you need to be careful. You cannot go as such collecting the blood. You cannot straight away go and administer in case of cat or kitten, because there are allo antibodies that are present in their blood. This will cause very serious transmission reaction to the cat or kitten. For example, B cat, we are giving a A-type blood, or B group blood, you are giving to A-type A group cat. It will cause very serious transmission reaction. One small amount of blood can end up with various serious transmission reactions. So what you need to do is you have to do a typing. There are 3 blood group in the cat: A group, B group, AB group. Once you type it, if it is a group, you can give A blood. If it's a B group, you can give a B blood. And then vice versa, giving of blood in cat, it will cause serious transmission reactions. Always educate the owner, tell the pros and cons of your cat blood transfusion, then go ahead with the procedures. These are all some of the informations concerned with the cat blood transfusion. I've been to Canada. There is a Canadian blood bank, veterinary blood bank that are available. They have all the staff. They are having the dog when they need periodically screen all the hemoproteasome disease, periodically given all the vaccines. And whenever they need the blood bank, they request the staff. They bring the dog and then they collect the blood, and they are able to supply it to the maximum vets in the country. And similarly, a country like us, this time we need to start the blood bank, and then the administrators are the policy maker of government of India. Then secretary in charge of animal husbandry in India, they can give a permission to the field practitioner to procure the blood bank and then carry on the blood transfusions. And the proper disposal of the waste also the practitioner or the veterinarian should take care of. Otherwise, it will become a biohazard. And then, this responsibility veterinarian should take. Administration side also, if they can start a blood bank in the country in the various states and various private clinic or the institution, they'll save many number of patients. All the state, they should give importance to our indigenous breeds. The indigenous breeds, their blood having special quality. As I mentioned in the beginning of my presentations, the Sipipare dog available in Tamil Nadu, they have a majority of them are 1.1 negative. That's a good observation, it's a good finding. So boldly we can collect the blood from Sipipare, you can transfuse. And I have a Sipipare in my hospital, in my shelter. So that saved a couple of dogs. And the size of the Sipipare also bigger. And maintenance also not like a pure breed dog. And it's suitable to our environment. These are all the advantage. Imagine breeds like pugs. The anatomical position of the nodes itself have problems. And the summer they cannot tolerate. Imagine there is a bleeding in the brachiocephalic breed, then it's become highly challenging. So better to keep a bigger dogs. The two, administrator, policy maker, veterinarian, they give importance to native breed. Even the army, BSF, security, national level security forces, they should give importance to our native breed, because I showed our native breed to the American expert who was giving idea to the Obama government. He's the veterinary defense officer. He visited.
Hatvet PHARMA presents Turbiraj, Terbinafine tablets, a trusted choice for stubborn fungal infection in pets. Turbiraj is available in the following formats: Terbinafine 250 mg tablets, Turbiraj 250, Terbinafine 500 mg tablets, Turbiraj 500. For placing order, contact our sales team or WhatsApp 98372 53817 or visit www.hatvet.com.
Chennai. That time I showed our Indian breeds like CP Parai, Rajabalayam, Kanni, Bombay. I showed a pure breed dog, Doberman, German Shepherd, and including Pug. Sir, which is the best dog we want to keep it in our security forces of Tamil Nadu government or the Indian government? He suggested no, all the native breed you are in Tamil Nadu government, all native breeds are dogs are in good. They can keep as a security dog. They can perform or they can perform better than like a pure breed dog, even better than German Shepherd. How you are keeping, how you are giving training, how they are, accustomed to your command, that is very important. So the message is the American, expert in charge of dog squad, what he told, no, the dog which are having long nose, they are intelligent. Our City Bara is having long nose, Rajapalai is having long nose, Kanni is having long nose. They are better than your German Shepherd and Doberman. He advised us to keep this dog as a security force in the state or in the country. It will save huge money and it will also protect you compared to pure breed dogs. That's the side by side. Coming to relevant to this topic, the dogs which are anemic, a bigger dog, you can collect more quantity of blood that can save many patients. Apart from that, the Sipiparai blood, doesn't cause any serious transmission reaction to the recipient compared to other breeds. So that quality is available that we need to promote, and that's what my recommendations with this topic. And yeah, now I'll go on with the one by one all the slides. So you can just. So anemia, already I told everything. I put it in my oral presentation for the past 1 hour 10 minutes, and we have a certain slides. So one image is equal to 1,000 words. So the image is telling you there is a pale buccal mucosa. Animal which are anemic, you should not be stressed too much, and too much handling also you may miss the patients. Animal which are having oral breathing, animal which are dyspneic, just without much disturbance, examine the animal. Just looking at the buccal mucosa, you can identify the anemic condition. Similarly, you can look at the conjunctive mucus membrane. Similarly, you can check female dog vaginal mucus membrane. Similarly, you can check a penile mucus membrane. You can identify the problem of anemia. Then identify the cause for the anemia. As I told, what are the various causative factors which causes anemia. Then you can address them accordingly. Most common indication for transmission: anemia, acute blood loss, immune-mediated hemolytic anemia. There's certain immunological mechanism which destroyed their own red blood cells. Apart from giving blood, in those cases, you have to give a steroid also. And if you are not treating the primary cause, you are giving IMHA case, you are giving blood, then fuel to the fire. Then again it will become anemic. Chronic anemia case also giving a blood transfusion is life saving, but here again you have to identify what is the cause that causing the problem. Then accordingly you have to address. So animal which are met with an accident, automobile accidents are very common in our country. Too many vehicles, and pets also, they follow the owners, and normally they identify the sound things, but when the owner they are following, they follow the owners. Sometimes when there's too many disturbances, there's too many instructions, they get confused, or too many vehicles coming. There is every possibility they met with an accident, and there are occasions you will have a pneumothorax, blood accumulation of thoracic cavity. There is an occasion you will have a pneumoabdomen. And those cases, you do an ultrasound, the presence of blood in the thoracic cavity, you will find the anechoic structures very easily. By using the linear probe, you can identify the presence of pericardial effusion, trauma, the blood vessel rupture around the pericardium causes pericardial effusions. You can see the myocardium, in between the myocardium and pericardium, not much of fluid, only a scanty fluid normally will be there, that we cannot visualize with your ultrasound. But in case of accident case, animals are having a pericardial effusion, you can see the presence of blood in the pericardium. and then you can treat the case accordingly, and you can give the better prognosis to the owner, and you can give the better comfort to the animals. So the blood loss in the abdomen, blood loss in the thoracic cavity, you can compensate by giving the blood transfusion. Similarly, the abdominal cavity, there are few dead spaces. One is hepatic diaphragm, another one is splenorenal here, then third is cystocolic, and the fourth is hepatorenal. These four spaces, there are dead space. As soon as the animal met with an accident like this, the blood vessel getting ruptured, you can see the accumulation of blood in all these sites. So then you do an ultrasound, identify the gun, do a HB value and a PC value. Normally, selection criteria, if the PC value less than 20, HB value less than 6, we'll take them for transfusions. These are all the criteria normally I follow in my practice. Next slide. This I told you elaborate informations, epistaxis, how they are coming in ecanis. Not only ecanis, if the animal is having a nasal tumor, nasal TVT, the animal will be having bleeding. You need to treat a nasal TVT with the vincristine IV. And if it is a nasal tumor, the nasal lymphoma, you have a multiple drug therapy, Madison, Wisconsin University protocol. We can start from vincristine, cyclophosphamide, doxorubicin, prednisolone. You need to give at various time interval. So by treating a nasal lymphoma by multiple chemotherapy, you can control. TVT by using vincristine, ecanis with the doxycycline. Similarly, animal which are having Babesia canis, animal which are having Anaplasma platis, Anaplasma drug absorption doxycycline, Babesia canis drug absorption diamidazole acetate. This Babesia zibzoni also can cause bleeding disorder like this. We use a triple therapy doxycycline metronidazole. So this is an important message, especially taking care of the animal with the bleeding disorders. Another important message is not only with this, sometimes trauma to the nasal cavity, it will bleed. Then sometimes fungal infections, rhinosporidiasis, it will bleed. So these cases, you need to identify the cause for the problem and accordingly treat. Already I told you, IPMA is a collection of blood in the anterior cerebral. I will show it in the subsequent slide. Already I told elaborate informations. So these problems get transmitted by the ticks. It also transmitted by the various type of ticks. And then these are all various stages of the even ticks also having larva stage, and then adult stage. There are various categories in that. And sometimes worm infestations, especially WCOM infestation, suck all the blood will make the animal to become anemic. Sometimes transplacental transmission also possible, and the young one also can get into anemic problems. And all flea infestation, it suck the blood, it causes anemia. So all these external, internal parasites, it causes anemia. So we have the tool to identify what is the cause for it. You address the problem, you can reverse the problem, the animal will become alright. So how the ticks and mite, fleas, lice is causing the problem in small animal practice. Common type of worms in canines, the roundworm, wigworm, hookworm, tapeworm. All these, it takes the blood from the, patients, and they make them to become anemic. Indication for the anemia, already I told you, anemia, coagulopathy, thrombocytopenia, thrombocytopenia, hypoproteinemia, all these conditions, acquisition of blood is absolutely essential. This is the coagulopathy. You can see the pinpoint hemorrhages on the subcutaneous regions of the skin. So while examination, most detailed examination is very, very important. Imagine the animal covered with a lot of fur. Is example Shih Tzu, Lhasa Apso, or even the furry German Shepherd. They will not be able to identify this problem. It's better to look at the eye and the ear flap, and keep the animal on the ventrodorsal view, examine all this area, so that you can identify the the coagulopathy disorders. It will give a clue. Based on that, you can perform the test and then treat them accordingly. This is the collection of blood in the anterior chamber of the eye. And you can see the cervical hematoma, the Bluish casket, the jugular vein infections. This problem due to rodenticide toxicity, and you can see the bleeding. This is the IPMA, collection of blood in the anterior chamber of the eye. If you can identify the primary problem, to treat that, now this dog is become blind. If you can treat that primary problem, suppose the problem is due to early shock, the reverse vision can be protected. And then already I told ideal dog donor what are the criteria. It must have a good weight. In Indian countries, it must have a more than 25 kg body weight. In other countries, it should be a more than 50 pounds. And the healthy adult under the age of 6 or so, they should have a heart murmur. Animals which are having a cardiac problem, we are not supposed to take it for blood donor. They should keep the up-to-date vaccinations. Not on any medications other than heartworm, flea, and tick. Free of bloodborne diseases and parasites. It's very important. Another important thing is you must have a calm dog. Suppose the dog is ferocious, you will not be able to collect the blood on time. And the owner also restless, recipient owner, donor owner also restless. Then it will become problem. So that's the reason I insist the staff member of the veterinary hospital or clinics or the front circles, those who are having dog, if you can keep, they can keep friendly dog, more than 25 kg body weight is better. Apart from one recent information, what they are doing, even the fear, what they say, even the pregnant dog they can donate. That's what the message nowadays stand. And you can see the blood typing, dog is 1.1, 1.2, 3, 4, 5, 6, 7, 8, like that. It goes on. And then cat, A is the most count, B very rare, A, B extremely rare. So the blood typing is absolutely important in case of cat. Without doing blood typing, if you are carrying on the blood transfusion, you will be in trouble. So better always do a blood typing on the board, because naturally all antibodies that are present in the cat blood, it will cause serious transmission reaction to the donated blood. You check the blood grouping and then carry on the transfusions. Okay, this is all about that. There are several companies. They have a product. One company called Alvidia Quick Test Dog Enclosure 1.1 detection kit available. Even IDEX also they are marketing. The rapid wet age canine card also available. You can see the ovulation on the card itself. There are several reference laboratories in abroad, US and the UK and Canada and all. I've seen a lot of blood banks. So individual they're running. It doesn't require a lot of expensive equipment like your CT scan, MRI. It doesn't like or linear accelerator. All those things it require a lot of money, a lot of huge crores it needs. Here, no, you don't need that much of investment. Small investment, 4 or 5 veterinarians join together, they can start the blood bank. But it is important life-saving procedures. It's the right time, vet should join and then start the blood bank. And any technical help, you call us. You can all contact Dr. Tyagi Hatvet. He will help us in coordinating with me and then your hospital. Some of the difficulties, severe anemia cases, the rapid wet was difficult to interpret. In the animal which are having auto augmentations, are unable to use this card. www.rapidvet.com. You get into the site. You get the details about how to use and the cost and everything. You can order it. You can make use of that in your practice. So this is the rapid vet kit. You can see the dog erythro 1.1 positive control. You can see the augmentation. 1.1 negative control. You can see the uniformity. Positive test again. You see the clotting here. So you can compare with this, and easily you can diagnose this problems. Similarly, dog blood typing kit 1.1 positive. See the 1.1 positive here and then positive kit here. The Alvidia also they are given the diagnostic kit like this, and they given some conjugate also. Add a conjugate and a few drops of blood. There is a strip available. The strip you have to dip it and then leave it for some time. You control well 1.1 positive, already one red color will be there. We get additionally another marking or the line indicating that donated blood is having a 1.1 positive. Then collection through the jugular vein, save the fur, apply some antiseptic and collect the blood. So simple technique, it is superficial only. You see the teamwork. One person resting there, another person holding the body, one person is collecting. Single man is not possible, it's very difficult. Animal also, they don't like. You will not be able to perform the procedure on time also, this technique. And see the collection of the blood. Sometimes the images and all clear, it seems to be self-explanatory. Sometimes the problem is, sometimes the needle can go subcutaneously. Sometimes the animal blood is hypotensive, you will not get the proper flow of blood. There are occasions you will also find the clotting of the blood in the pubic systems. All those things, we can encounter in case of oil collections. It's a teamwork. Similarly, feline blood type kit marked with rabbit with H feline cord, and you can see the agglutination how it will come. And so the deduction of see, this is the control well, you getting a red marking here. If it is A blood group, you get a 1 marking here. If it is a B, you will get a 1 marking. If you are getting AB, that is rare, you will get a 2 marking here. So that you can identify the blood grouping, accordingly you can plan. And even similar to dog, cat also, there are certain criteria available. Never had a blood transfusion before. Those cases you can.
Hatvet Pharma presents Azithrohat, azithromycin syrup and tablets, the cure that embraces with care. Azithrohat is available in the following formats: Azithrohat oral suspension, Azithrohat syrup, azithromycin tablets, Azithrohat 300 tablets. For placing order, contact our sales team or WhatsApp 98372 53817 or visit www.hatvet.com.
Select fit and healthy cats you have to take, up to date with the flea and deworming. Age between 1 to 10 years can become a donor. Weight over 4 kg but not overweight. Those cases you are no health ill conditions, up to date with vaccinations, not on any medications, never traveled abroad. So these are all the criteria for the blood donor program for cat. On 4 kg cat, quite difficult in our country, but there are places there are 4 kg cat that are available. You can collect. You can see the subsequent slide. You can understand how the blood being collected in cat, how they use it for saving the critically ill animal. All those things. So the blood collection in cat, you can see the small 30 cc syringe. There is a 3-way tap and then butterflying it. Already it is coated with the heparinized coating inside the tubing system. What you have to do is you collect the blood from the jugular, restrain the animal, save the fur, then collect the blood from the jugular. Then after that, these are all transferring back. You can transfer to the transferring bag. The small quantity mini size bag that are available. With the help of that, you can store how much is the quantity you want. Then you can administer. The 1 ml of CPDA or a citrate for 9 ml of blood, you can use as an anticoagulant. And next, the blood collection bag, see, I told you quantity, 350 ml bag, 39 ml is the anticoagulant. Normally, the citrate phosphate dextroadenine solution is an anticoagulant normally used for normally used in blood bag. Blood collections, how they are doing in a cat, see how they are restraining, how they save the area, apply some antiseptic. Introduce the needle, how they are aspirating with the 30 ml syringe. Then transferring the blood from 30 ml syringe to the black bag. Then there is administration. Then blood collections, while collecting, you can also check the weight of the blood bag. And then, you you can, after weighing, you write the details of the particular particulars of the donor dog, detail on the blood bag, when they collected, what are the blood grouping, all those things you have to write. Then component, the whole blood divided into various components of the blood. So there is a high centrifuge available in many of the blood bank, and that they use for separating the whole blood into various components of the blood. I told you, patients which are affected with renal failure, if they need red blood cell, we can give only red blood cells. Patient are affected with renal cardiac problem with low WBC count. If you want to give WBC, give only WBC instead of giving whole blood. That is called component therapy. And intraosseous, which I told you already, if you have a problem with accessing a peripheral blood, cephalic vein, jugular, go for intraosseous. You see that there is a ordinary 21 gauge needle they used after saving, infiltrating with the lignocaine, and through that, they are sending the blood to another IV set. They are administering. This is the way they are using the lateral canal of the humerus. This is the way they do buccal mucosa bleeding time. There is a small equipment, just make a small incision here. Normally, within few minutes, it has to clot. It doesn't clot even after the 5 minutes, then it's having a coagulopathy defect. Now, many of the critically ill animals, hepatic failure, renal failures, due to various problems, giving a blood transfusion blood is a life-saving work. But they must also should be in a good environment. The area should be clean and sterile, assisted feeding, warming bed, support with the white result. All those things also important for speedy recovery. Apart from that, the owner touch is also very important. This is the way, how the thrombin is getting formed. Factor 7A, then factor 9A, then factor 7A, 9A, 10A, 5A, prothrombin converted into thrombin. Similarly, this is another pathways. Factor 7A, with the availability of 10A and 7 and the 7A and the 5A, you have the trace thrombin formation pathways. These are all playing an important role for if there is any hurt, and this formation of thrombin, prothrombin, these pathways is very important. Animal affected with any coagulopathy defect, or you take any factor deficiency, this formation getting prolonged. So the more the time they prolong, that means more they have the problems. That's the way we need to address this problem. And this is the nutshell information about the blood bank in a small animal practice. And what are the other update which we which want to include? Blood donor program. That is another important thing. Blood donor program. Each hospital they can create a blood donor program. They must give some incentives, like probably you can give a free vaccinations, deworming, give transportation. Then only the pet parents they can bring the dog to a hospital, so that you can do some you can advise them to bring their dog for blood donations. Then we can perform the procedure on time. Many times with my several years of practice, if many times whenever we need arise, getting the blood bag becomes challenging. There are a lot of issues, and blood donor becomes challenging. Many of the pet parents they won't bring their dog on time. Dog answer they may not be willing. So that's the reason I insist, if you have a couple of dogs in your premises, you can save the critically ill animals on time. Probably that blood bank, it should be available for round the clock, and you can do the correct job to save the critically ill anemic patients. and we need to work on with a lot of hemoproteasome disease that are available in the country. That has to be addressed. We need to have a state level database. We need to have a national level database that will help the policy maker to decide about controlling the tick populations and controlling the tick related disease spreading to human beings, so that veterinarian role uh, is playing an important role not only with the animal welfare, it's also with the human welfare. Majority of the disease, if we can control animal side, so human being they won't get any problems. So indirectly we are working for the welfare of the human beings. So that's all the key informations. And then get the opinion from the owner, counseling the owner, get the consent from the owner. It's very, very important. So sometime the 4 or 5 veterinarians join together, starting this type of blood bank, spending for very small amount of money. You can run this, and before that, as I said, you have to get the permission from the institute, the authorities. You can avoid this problem. So these are all the worldwide informations, the latest informations available on bleeding emergencies, how we need to address the bleeding emergencies, what are the protocol you have to follow, how to select the donor, how to store the blood, how to separate the blood component, when you need to give the various component, or when you need to give the whole blood, what are all the legal problems veterinarians are facing in the country, how best the blood bank playing a role in taking care of the you know um, anemic patients, what are the pros and cons of the cat blood transfusion. Another important thing is most of the kits available are imported. So it is the right times we need to make our own indigenous product, and a few trial going on with our colleagues. Even we also proposed to identify the all diagnostic detection kit cheaper price. For example, you take commercially available hemoproteasome detection kit. It comes anywhere around 2,000 rupees or 1,900 it comes. So once if you don't have the, it's quite expensive. If you can reduce the cost, you come out with the cheaper variety diagnostic kit, we can save many number of patients. And then you also tell the owner the bleeding disorder due to many means. Even trauma can cause the trauma, you have to address fungal infections, you have to address tumor, you have to address coagulopathy disorder, you have to address, then poisoning. Then poisoning, any poisoning will cause bleeding disorders. For example, even in case of we didn't include about viper snake bite. Viper snake bite, it destroys all the clotting factors. Wherever you poke the needle, it will bleed. Wherever blood vessels are there, it will rupture. It will cause hemoabdomen, hemothorax. If the poisonous levels are very high in viper, every possibility is anemia related issue. The dog will die. So apart from giving an antidote for tackling the viper related bite, in spite of antivenom, the dog is anemic. Giving blood transfusions will be of more useful to save the animal from the critically ill conditions. And all on the other poison, rodenticide poisoning, which I told you earlier, we need to tell the owner. We need to tell the owner if they suspect the rodenticide chemical accidentally ingested by the dog. We need to tell them what type of chemical that are present. There are various chemicals that are using for killing the rat in the rodenticide poisoning. So you advise them to get the correct label or correct drug, so that you can select the antidote accordingly. So with this point, I will conclude my talk, and I would like to thank Dr. Tyagi, Hatvet PHARMA Private Limited, for inviting me to take care of all the emergency topic. and we have covered a few topics earlier. This is one of the bleeding emergency. We want to share it with our academic friends, and any other questions, other things, you have a email, the number is the WhatsApp number. Text me so that when we are free, we'll be in a position to answer all your questions. And we will take care of the critically ill anemic patients. Thank you very much.
For placing order, contact our sales team, WhatsApp at 98372 53817 or visit www.hatvet.com. Thank you.